So, you've been listening to podcasts about hydrogen therapy. You've been looking at this website and all of the information, and you may be thinking, is this hype or hope? And I'm going to clarify with you all the information about the science and my own thoughts on it. So, when I started back in 2017, I was literally making hydrogen machines from scratch, and this was our first evolution machine after that. And these machines generated around 300 to 400 mils of molecular hydrogen a minute, and they were good. And I thought, okay, they clearly help. I'm getting good feedback, and in my mind I was thinking, oh, okay, I'm helping someone 5-10%, and they're doing other protocols to add in, so it's nice and simple. But things have evolved, and as you'll see through this video, it's gone up quite a few notches since then. But if you want the black and white science on hydrogen therapy, it is there. And on this page, if you scroll down, you'll see that since 2007 there's over 1,300 scientific studies being conducted on molecular hydrogen, and it clearly shows if you're in a Japanese hospital and you have a heart attack, they're going to give you molecular hydrogen and oxygen. If you want a preventative treatment in China or Japan, they're going to give you hydrogen and oxygen. We know that athletes really benefit from hydrogen therapy. We know it reduces inflammation. We know that it's a really good adjacent cancer therapy to support someone going through mainstream medicine. And we know that it helps with longevity and beauty. So that's all there. You don't need to worry. It's black and white, it helps. The next stage that I want to talk about is like the emerging science. So the science for example, there's a single hospital in Spain, and they're looking at how hydrogen therapy can help kids with ADHD. And they're finding it really helps, but they're finding that with the small level machines, like the 400, 500 mil, it's not giving hardly any results. But as soon as they're moving up to 1,500 mil, 3,000 mils, they're really seeing clear results. So this emerging science is saying it's the dose that really matters in difficult cases, and that really needs to be considered. Then the next thing I want to talk about is single case studies. Single case studies aren't duplicated many times, so they don't hold much credibility and oomph. But there is a medical study below with a lady 51 years old, and she had metastasized brain cancer, so very serious. And she did a lot of the mainstream treatment, and then she had a pause afterwards, and she went on a very strong hydrogen oxygen protocol she spread it out 6 hours a day throughout the day at 3,000 mils. And I haven't seen that type of like high dose treatment before, but the outcome was quite incredible. It was a 90% reduction in the brain tumor after 8 weeks. But then when I think about studies like that, my brain says, look, if a doctor is giving someone a treatment like that, more than likely they've tidied up the diet, more than likely they've tidied up toxicity. And I think there's more to it, and I just want to explain to you why I think there's more to it. So if you take an autoimmune disease, if you take Crohn's or ulcerative colitis, you ask yourself, well, traditionally the doctors will say it's the immune system attacking itself, and yes, it can be viewed that way. But it could also be viewed, is it an adverse reaction to foods? Because I know if I eat the wrong foods, I've got an adverse reaction, and I've will have an autoimmune response? Is it toxicity? Is it lack of vitamin D? Is it lack of minerals? Is it lack of probiotics? Is it a lack of foundation of just good quality sleep? And when you start stacking things in and using like common sense, if I asked you the question, if someone had high cholesterol, and I would say to you, well, what's the priority? Reduce the bad fats, or increase the good fats, the omega-3s and 9s and what have me. The most important thing is reduce the bad fats, the seed oil, the corn oil, the soy oil, cooking in even olive oil, which olive oil is a good oil, but if you cook with it, then there's a toxicity to it. So it's about reducing things, and as soon as you start reducing things, whether it's the ultra processed food, the lack of sunlight, even the psychological things of being isolated, to just, I go out for a walk in nature and I feel fantastic. Maybe it's the lack of community. All of these things help our health. And I get to the conclusion of why I'm sort of talking like this. So the next thing is that when I was 15 years old, I was sitting with my gastroenterologist, long word, and I had ulcerative colitis. And I was talking to him about all of these, can I do a specific carbohydrate diet? Can I do these soil bacteria and what all of these other protocols? And he said, look, your best bet is to wait for a drug to be designed to overcome ulcerative colitis. 35 years later, the same drugs are there to treat ulcerative colitis. They're no closer to a cure to ulcerative colitis. Then there's another area, okay, which is I'm a bit of a geek with health equipment, and my sort of first real initiation with this was I studied with someone called Sir Peter Guy Manners, and I did an apprenticeship training with him. He developed cymatics. Absolute incredible, eccentric genius. And there was a moment when I was 18 years old where I had bloody stools, I had really bad pain, my colitis was really flared up, and I had a sound treatment with him. So basically he can take sound frequencies of healthy large intestines and then put it into my intestine. And it was like, after that one treatment, it was just like night and day. I was like, it was a miracle. 100% better the next day. Normal stool, felt really good, fantastic. And that's why I did an apprenticeship with him. But what does an 18-year-old kid do? Well, 2 weeks later, go out with some drinks with my friends, eat lots of rubbish food, and that treatment only lasted 2 weeks, and I was back to square one 2 weeks later. So this is the conclusion of everything I'm saying. I really don't believe, for the majority of health problems, there's a dream drug. I do believe in the best of mainstream medicine, and I believe in the best of holistic medicine. And I don't believe there is a dream bit of health equipment out there which will do everything, because the key foundations are so important. The right sunlight, the right sleep, the right omega oils, and so forth. But I know for a fact, hydrogen therapy at a very nice dose really helps. And my passion is to say, look, say it as it is. You know, my dad always taught me to be absolutely straight with people. Say it as it is. Hydrogen therapy really helps, but stack on the other good things. Don't be like gormless and say, oh, I'm counting on the pharmaceutical drug, I'm counting on the machine to heal me. Get the best of everything. And then I believe these things that people getting really fantastic results, because that's what I really want. People to get really fantastic results, but to get really fantastic results, you've got to be switched on in life. So enjoy the science page. Cheers, guys.